Potential job sites. Often free clinics are established by the local public health agency to help meet the needs of the community. Rehabilitation occurs after a patient has been stabilized following an acute illness or injury, once the diagnosis is made. The rehabilitation phase can last days to years. Examples of services in skilled nursing include, but are not limited to, doing wound care and changing dressings after a major surgery or administering and monitoring IV antibiotics for a severe infection. A physical therapist helping to correct strength and balance problems that have made it difficult for a patient to walk or get on and off the bed, toilet, or furniture. A speech therapist helping a person regain the ability to communicate and or swallow after a stroke. An occupational therapist that helps a person relearn independent self-care in areas such as dressing, grooming, and eating. Skilled care may also be needed on a long-term basis if a resident requires injections, ventilation, or other treatment of that type of nature. Skilled nursing facility placement criteria includes a client that cannot take care of themselves because of physical, emotional, or mental problems. They can no longer care for their own personal needs, such as eating, bathing, using the toilet, moving around, or taking medications. In other words, custodial care. They may require more care than can be provided by their caregiver and cannot live alone. They might wander away if they're unsupervised. They have extensive medical needs requiring daily attention or monitoring by an RN supervised by a doctor. Is going to be discharged from the hospital but requires temporary skilled nursing care or rehabilitation before returning home or to a residential facility, or has been recommended for a nursing home by a physician. Custodial or personal care are for people who are able to recover from a disabling injury or illness, but they might temporarily need custodial care because they still need to get strength back and balance, etc., to be interdependent or to be independent again. It may be for people who are losing their ability to function independently due to chronic disease and increasing frailty. It might be a long-term need. In most severe cases where a person is bedbound, ongoing supervision by an RN is necessary along with the custodial care to ensure hydration and nutrition and prevent skin breakdown. If a custodial care resident becomes ill or injured, they might spend a period of time in skilled care and then return to custodial care. Whether a resident is under skilled or custodial care is important in terms of who provides the care and who pays for the services that are provided. Long-term care is a variety of services, and it supports to meet health or personal needs over an extended period of time. Most long-term care is non-skilled personal care assistance, such as helping perform everyday activities of living. Nursing home and some skilled nursing facilities are facilities with 24-hour medical care available. It includes short-term rehabilitation, such as physical therapy, as well as long-term care for people that have chronic ailments or disabilities or require the attention of nurses in addition to help with personal care, such as bathing, dressing, or getting around. Independent living is for healthy seniors who are self-sufficient and they want the freedom and privacy of their own separate, easy-to-maintain apartment or house, along with the security and comfort and social activities of a senior community. They really don't need personal or medical assistance. They like living with seniors who share similar interests. Board and care homes would be state-licensed assisted living for people who need minimal assistance with personal care, such as their ADLs. but who need or want communal meals and easy access to social contact with peers. It also provides assistance with facilitating self-administration of medications and transportation. Enriched housing is similar to adult homes, except the seniors live in individual housing units. Assisted living emphasizes a resident's privacy and choice. Residents typically have private locking rooms and bathrooms. There's numerous kinds of housing with services for people who don't have severe medical problems, but who need help with personal care such as bathing, dressing, grooming, or maybe meal preparation. With continuous care retirement communities, these provide a continuum of living options from independent living, enriched living, assisted living, and skilled nursing home, all on one campus. So the residents are able to move from one level of care to another as their needs begin to change. It is a complex of residences that include independent living, assisted living, and nursing home care, so seniors can stay in the same general location as their housing needs change over time, beginning when they are still healthy and active. Residential care includes community health nursing services, where residents or patients are screened for early detection of disease. It provides services for people who need care outside the acute care setting. It may exist as a part of an outpatient clinic service, or a service attached to an HMO, or a freestanding private service. Home health agencies increased focus on family and the patient's environment. The purpose is to promote, maintain, or restore health or minimize the effects of illness or disability. It in and of itself has contributed to the most cost-saving measure in health care. Skilled services in home health care can include skilled nursing, physical therapy, speech-language therapy, occupational therapy, medical social services, homemaker health aid services, or other therapy services might be offered. With adult daycare centers, certified nursing assistants and personal care assistants are available to meet state requirements and assist with ADLs. Volunteers also play a major role in some of the adult daycare centers, but basically it's going to provide services for people who are for caregivers who need a day away, or they go to work or something, and the person that they are a full-time caregiver for is unable to be left alone. Wellness centers are places like fitness clubs, Weight Watchers, smoking cessation programs, stress control, or parenting parenting classes, for example. Hospice provides end-of-life services for people who have become certified as terminally ill. Because RNs, LPNs, home health aides, CNAs, and volunteers all staff a hospice home, home care can be tailored to the person's needs. Hospice can be provided in the home, it can be provided in an institution, or a freestanding agency. LPN's skills are utilized by home health agencies in some areas, and they play an important role in the home health agency to teach self-care to the client and the client's family.